I now give the floor to His Excellency Svatopluk, Němeček, Minister of Health of the Czech Republic. You have the floor, sir.
Yeah. Dear Excellencies, dear friends and colleagues, thank you for giving me the opportunity to address this excellent roundtable on behalf of the Czech Republic and to share our experience in the field of demand reduction and the drug policy in general. It was 25 years ago when the Czech Republic, Czechoslovakia in that time, decided to reform its legislature inherited from communist totalitarianism by a package of amendments steered by humanitarian values. Among other changes, the abolition of death penalty is highly relevant for this venue. It was driven by the belief that there is no human and no human organization that have right to kill people intentionally, even not in the framework of formal legal process. We believe so because we all know miscarriages of justice in every country of the world, including the Czech Republic. Miscarriages of justice might be corrected or compensated, but only if the victims of such miscarriages stay alive. By definition, this is not possible when death penalty is applied. Among a number of other human rights-driven changes of the totalitarian legal code, we also introduced the depenalization of drug use and the decriminalization of drug possession for own use. In other words, Czech Republic has a quarter of a century of a drug policy based on decriminalization and within the 3 UN drug conventions. Let me stress that together with it and as a part of it, the Czech Republic has equally long record of drug policy that is fundamentally steered by science and evaluated by science. Our drug policy rests on 4 pillars: prevention, treatment, harm reduction, and law enforcement. Each of them is considered as one of 4 tools of equal importance, and none of them can be replaced by another one. I want to be clear that harm reduction is a pillar of the same importance and irreplaceability. It aims to keep alive people suffering with drug-related disorders and to improve their health status in areas other than the very addiction which they are not able to rid of in the given moment. Importantly, it protects the non-drug using population from infections of which drug users would be pools of if there is no harm reduction. We have some results to show based on verifiable data checked by the EU leading scientific body, the European Monitoring Centre for Drugs and Drug Addiction. We have the lowest number of fatal drug overdoses per capita globally, 5 people per million. We are in the small group of countries with the globally lowest prevalence of HIV and AIDS among injecting drug users, less than 1%. We have a uniquely low prevalence of viral hepatitis C, below 20%, and B, below 6% among drug injectors, probably the lowest globally. Organized violent drug crime is virtually non-existent in the Czech Republic. Last but not least, some 85% of our problem drug users are in the regular contact with harm reduction services. This allows for much earlier entry into abstinence-oriented treatment and for exceptionally high recovery rates, that is abstinence from drugs. In this area and in many other areas of drug policy, the role of non-governmental organization has been immensely positive and completely irreplaceable. The data I just showed mean that the Czech Republic is a country with comparatively very low social and economic cost of illicit drugs. It is not because the Czech Republic would be a drug-free country. It is because we have done our best to make the Czech Republic a country where the harms related to drugs are as low as possible. To minimize the use of drugs is one way to do it, and we have used it. As a medical doctor bound by the rule primum non nocere, I am perfectly okay with it. As a minister responsible for the public health in my country, I cannot be more okay with it. Following the scientific evidence, in 1998, the Czech Republic introduced opioid substitution treatment in full accord with recommendations of WHO and UNODC and the EMCDDA. Not surprisingly, it has worked and it has saved numerous lives of Czech citizens. In 2013, my country legalized the use of medical cannabis for symptomatic treatment of severe symptoms of illness where other treatment agents are not sufficient or have dangerous by-effects. This applies specifically to treatment of mid and severe pain, spastic pains in neurologic disorders, mild nausea and vomitus, and a number of other symptoms. Additionally, there is a great deal of hope that when scientific research fully understands the role of endocannabinoid receptors in human body, we would be able to treat a wide range on severe illnesses also causally, that is, cure them. This was done in response to calls of patients and their associations. The very legal decision was based on careful review of available scientific literature undertaken by independent medical and scientific bodies. Have done so, we believe we fulfill the original intention of the UN Conventions on Drugs to promote health and welfare of humankind. As a signatory party all three UN conventions, we repeatedly invited the International Narcotic Control Board to review and debate the planned developments of our drug policy, and after some discussion, we were assured that we operate within the framework of the drug conventions. In a sense, Czech Republic may be seen as an example that the UN treaties allow for what we considered pragmatic and effective drug policy. On the other hand, we are aware that some less wealthy countries may not be able to go through the demanding process of consultation with UN bodies whenever they want to modernize their drug policy. This is why we support so much the call of the European Union for enhancement of the coordination between UNODC and the other UN entities, especially the WHO, but also the INCB, UNAIDS, and OHCHR. One of the first outputs of this enhanced coordination and cooperation might and should be a simple list of interventions in drug policy and the assessment of their compliance to UN treaties. We firmly believe this would be of immense help not only my country but all UN member states to steer their drug policies more effectively and economically. Thank you for your kind attention.
Thank you, Your Excellency. I now give the floor to His Excellency Roberto Moro,